Good morning. Today we are going to talk about understanding Medicare supplemental plans. It is tons of information that I hope will help you understand what choices you have when you age into Medicare. And so I'd ask that if you have any questions that you hold them till the end of the presentation, and we will definitely spend some time going over each of the questions that you have. And now we will start. First, we're going to talk about the parts of Medicare. Under Part A are the benefits that cover things like inpatient care when you are confined in a hospital, inpatient mental health care, skilled nursing services, hospice, and some blood transfusions. Under Part B, you have all the outpatient ancillary services such as physician services, outpatient hospital services, ambulance, outpatient mental health, laboratory services, durable medical equipment, things like oxygen, wheelchairs, things of those, outpatient physical therapy, occupational and speech language therapy, and some preventative. Please understand that under Medicare, Medicare covers 80% of those benefits. Now we're going to talk specifically about the gaps in Medicare. Under Part A, if you just have original Medicare and you're hospitalized, you will have a deductible that's $1,408 between 1 and 60 days confined in the hospital. $352 per day between 61 to 90 days. $704 between 90 to 150 days, and no coverage after 151 days. Under nursing, the first 20 days you have zero copay, and from day 21 to 100, it's $176 per day, and no coverage after 101 days. Again, Medicare is designed for short-term, not long-term. For Part B, if your income is under $87,000 as a single individual or as joint $174,000, your monthly premium is $144.60. Please take note that if your income is higher, above $87,000 single or $174 joint, the premium will be higher, as high as $491.60. To look at the specific details based on that income, you can certainly go to medicare.gov, or I would be more than happy to answer specifically questions at the end of the presentation. Some additional cost is that you will have a $198 deductible per year, and 20% of the Medicare approved services would be your out-of-pocket in the event of those services being utilized. And one of the benefits that is not understood under Part B is that Part B does not have an out-of-pocket limit. That means that if you have been confined more than one time in any given calendar year, your out-of-pocket could exceed from $1,000 to $100,000 to $1 million. I mean, there is no out-of-pocket limit. So it's very important to understand that gap that most individuals don't get to really get educated on. The two options that you have under Medicare is Medicare Supplemental Plans and Part C. Today our focus is going to be to talk about Med Supp plans. And a good portion of 2% of the folks that age into Medicare remain on simply original Medicare. So let's talk about specifically how Medicare Supp plans work. They are primarily sold by private insurance companies. They're designed to cover the gaps in Medicare for Parts A and B. Sometimes they're also referred to as Medigap. There are 10 standardized plans that allow for easy comparison. In the state of Massachusetts, Minnesota, and Wisconsin, they have different plan designs, and Med Supps are usually regulated by state and federal agencies. Here we are going to look at all the 10 plans that are available. A through F. The difference in benefits, as you can see, is that the higher the coverage in the gaps, the higher the premium. The lower in the gaps, it's going to give you the flexibility of having a much lower premium. So let's look at specifically Plan F. And if you could see, if you turned 65 before 2020, Plan F is only available. And Plan F, for instance, covers 100% of the gaps for Part A, B, and Part A deductible, Part B deductible, and Part B excess charges, as well as foreign travel. Now, that plan tends to be a plan that is recommended for those beneficiaries that are high users of how they are consuming coverage. Obviously, if you have an individual that is not a frequent user of the benefits, and that's where you would have the ability to look at other plan options that offer offer less coverage on the gaps. For instance, Plan K being the lowest premium of the Supp plans, because you're basically sharing the cost to a 50% under the Part B as well as Part A deductible. Now let's move on to the disclaimers that we have for the Med Supp plans. Plan F and G are also the higher end plans, and really the biggest difference between F and G is that Plan G, you have to pay the Part B deductible, which again, that deductible is $198 for year 2020. For plans K and L, after you meet your out-of-pocket yearly limit and your yearly Part B deductible, the Medigap plan pays 100% of the covered services for the rest of the calendar year. And obviously, Plan N pays 100% of the Part B coinsurance, except up to a $20 copay for some office visits and up to $50 copayment for emergency room visits that doesn't result in an inpatient admission. One of the things that is very important to understand is that Medicare supplemental plans are your secondary payer to Medicare. As I said earlier, original Medicare pays 80%, so your supplemental plan covers the gap of that remaining 20%. Guaranteed renewable is one of the things that is very important under a Med Supp plans. It cannot be canceled as long as the beneficiary pays their premium. And obviously the freedom to see any provider facility that accepts Medicare, because 95% of all physicians and 98% of all facilities. Clients can enroll anytime, so you have the flexibility to enroll at any time, as well as during open enrollment, which, by the way, open enrollment for most folks is October 15th through December 7th. It also has guaranteed issue. That means that when you are new to Medicare at age 65, that year you are not required to answer any underwriting questions. Supplemental plans are also underwritten, so if you are past that guaranteed issue first year, you are subject to the underwriting questions. Clients must purchase separate Part D if they want RX coverage. So with a supplemental plan, all the benefits are a la carte. That means that you would need to add the Part D for your prescriptions, and obviously if you wanted vision and dental and all the additional ancillaries, those would also be purchased separately. A Medicare supplement plan is key because it allows the client to pay a set premium. Premiums usually can change annually. However, the better the coverage, the higher the premium. For example, as I said previously, Plan F will have the highest premium. However, it covers 100% of that gap or coinsurance. Plan K, if available, is generally the lowest premium option. Now let me ask you, why are Supp plans better? Well, they are fully insured, they are guaranteed renewable, the annual rate increase, any provider, any facility that accepts Medicare, which means you have the freedom to pretty much go anywhere without that referral. Unrestricted enrollment, underwriting, you have to have the separate Part D, and it's federally and state regulated. Now let's look at some case studies so that you can put this into perspective in terms of how it works. Mark lives in Des Moines, Iowa. He is 68 years of age, retiring from his job, dealing with a chronic condition that has him visiting his doctor on a monthly basis. He was advised that he will eventually need specialized surgery in the future. The doctor recommended that he go to Mayo Clinic to have that done. Mark signed up for the American Continental Plan F. It's an A-rated carrier with stable rate history. It allows him to use his Medicare benefits at Mayo Clinic when the time comes. He had Aetna as a group insurance carrier when he was working. In the case of Joseph, he lives in Hershey, Pennsylvania, 63 years old, qualifying for Medicare due to disability that keeps him from working, treated with pain management and regular visits to the doctor. He fears that he will need the help of a wheelchair in the future to stay independent, may need to move to an assisted living. He lives on a fixed income with Social Security and his 401k. He cannot afford any surprises. So obviously Joseph signed up for the AARP, Medicare Supplemental Plan F. The rates are the same as someone who's 65, and they have averaged a 2.1 increase since 2013. He likes that his monthly healthcare costs are fixed and found an affordable Part D plan to help pay for his meds through mail order. Now I will say Plan F in the state of California, if you are under the age of 65, is a little bit higher than the average 65-year-old. So that rule is slightly different in the state of California. The case study for Evelyn. Evelyn lives in Newport Beach, California. She's 65 years old, has a lung disorder. She sees specialists in Orange County and LA County at UCLA Medical Center. Her doctors do not accept HMOs. She wants the freedom to access doctors without a referral. Evelyn signed up for AARP UHC Plan F. She added an affordable Part D plan for her medications via mail order. Likes knowing that her monthly costs are fixed and reasonable and will not be billed for copays nor coinsurance. She travels to various states and is able to access doctors across the U.S. So what's important about a Med Supp plan? Think about if a Medicare supplemental plan when a client doesn't want to pay copays nor coinsurance. Client doesn't like the idea of a network, and client cannot afford a surprise of $1,500 plus for hospital copay. So that sums up today's presentation about supplemental plans. Thank you for your time, and we will be getting ready for questions that may be specific to your situation.
No question.
The freedom is one of the things that is very attractive to a lot of beneficiaries, and with the freedom comes the cost. However, what's really important to take into account is that the premium is pretty predictable. You won't have any surprises. So I always say in the long run, it ends up being less expensive than going with a supplemental plan that has lower coverage. I'm of the belief that, once you have the Cadillacs of the plan, you don't have to worry. It's predictable, and in the long run, it ends up being more cost effective. One of the other questions that is very common is, Why is it important to have that freedom? Well, unfortunately, we don't know, what's going to happen 5-10 years ahead. I actually had my health event at age 39, and one of the advantages that I had at the time was having the freedom to go to any doctor to be able to determine a diagnosis for the disorder that I have. So, healthcare is one of those things that you want to have that freedom so that if that time were to come or happen in the future, you're able to obtain the best medical care that's available in your demographic area. Again, thank you for today, and I look forward to seeing you in the next